I'm going to talk to you today about what to do when you get a sunburn. We all know that the sun is stronger and that there's less ozone, so more harmful rays reaching us. So it's more important than ever that we wear a sunscreen, at least SPF 30 or greater. But those times do occur where you might not have applied sunscreen as liberally as you should have, or might not have reapplied. So let's talk about what to do. There's a few key things you should remember. The first thing is you should use a damp cloth and put cold compresses on the skin to try and take the heat out of the skin to soothe. We get a little bit dehydrated with all the heat loss there, and that can be very uncomfortable. The second thing you can do is take some ibuprofen, especially if you have soreness and chills associated with the sunburn. Make sure, though, that the ibuprofen is safe for you to use. The third thing you can do is take a cool shower or cool bathtub. This will also help hydrate the skin and cool you off. A colloidal oatmeal bath is also very helpful. Another thing you can do is leave the blisters alone. Probably the worst thing people do is open up those blisters, thus opening themselves up to infection. Leave those alone. Let those peel on their own. The last thing you can do is apply some lotion, and namely the lotion I would love you to use is something that contains aloe vera. Aloe vera can be very soothing and cooling to the skin. A few things I want you to avoid are petroleum jelly or petrolatum, benzocaine, and lidocaine. The petroleum jelly can seal in and keep the heat in, and benzocaine and lidocaine, topically applied, can really irritate some people. In general, you've got to wait 3 to 5 days for that sunburn to go away and that skin to start to slough. And in general, you want to be very careful with your skin. Leave well enough alone and don't try to exfoliate too soon or you'll cause yourself a lot of pain. Certain symptoms that may require you to seek a doctor's care would be vomiting, nausea, lightheadedness, and dizziness. But in general, you just have to weather the storm.